the majority of our patients, I think we researched the numbers in almost like 79% of our patients are over 80. So they're going to need a wheelchair or a hospital bed, or they're going to need something, and they're having to be discharged home without those hospital beds or without those wheelchairs. And then we're in a scramble to try and find them. Like the low beds, I know that they come from a company, like this is Denton, and we searched and searched, and we finally found a company that did the competitive bidding in Garland, and that's about 27 or 28 miles east of here. So when I finally got them to agree to bring a low bed for a patient who had came out of hospital with a hip fracture and who'd fallen twice on a regular bed in the assisted living, they ran all the numbers, which took several days. Nobody would answer. I'd have to leave a message. They would call. I would be out with a patient. I mean, it was like a 7 to 10 day ordeal. And then finally, when they did agree to, they ran the numbers. Her Medicare numbers were good, but they'd only deliver it out to this area on Tuesdays. So here we are, looking at 2 weeks after this lady's been discharged from the hospital in need of a low bed, who fell and broke her hip off a bed and has fallen off a regular bed twice. So we're learning to improvise the best that we can, but it's not in the best interest of the patient or safe, or keeping the patient safe. It's keeping the patient safer. Mm-hmm. We had someone who was sent home to an assisted living from out of town. There was her caregiver died unexpectedly, so her family lives here, so they brought her up here to put her in an assisted living. And she needed a wheelchair, and all the facility had was just a transport wheelchair because she couldn't walk, and she needed a low bed for frequent falls. I mean, we couldn't, it took us over 2 weeks to get that for her. She had like 3 falls in that 2 weeks. We had someone discharged from the hospital with a wound vac who had fallen, had a hip fracture, and had a surgical replacement of that hip that had got infected and dehisced. So she was stuck laying on her back. She really couldn't lay on her side because that was where the wound was. And we had put her on the other side, but she developed a cubitus on that. So there was only her back or her side we could place her on. The hospital, when she was discharged, they ordered an air mattress and a hospital bed because she was falling out of the bed. We tried for 3 weeks. The decubitus on her coccyx, on her both buttocks and on her hip got worse. We put catheter in to keep her as dry as possible. We could not get a hospital bed with side rails, so we had chairs pushed up to keep her from falling out of the bed. And the family gave up. We just finally gave up and purchased that equipment because the decubituses were fixing to get to a point where she would probably had to go in and have medical intervention for them if we wouldn't have. So competitive bidding has been a nightmare for especially the rural areas or a smaller suburban area out of a large town, because the small DME companies that we counted on, that we had a relationship with, who would come forward and say, we'll get that out there for you this afternoon, even if we have to stay late, that's gone. We don't have that relationship. We have one company that serves the whole Dallas Metroplex area, and there really is not, I mean, I'm sure they're doing the best they can, but every time I call, it's still staffed with one person, even though I'm sure their business has gone up by 100%. So the service is not there, the equipment is not there, people are not getting out of the hospital in a timely manner, they're going back to the hospital, they're falling, they're developing skin problems, they don't have wheelchairs, they're getting walkers, and it's not because we don't have the equipment, it's because we can't get the equipment. The doctors are asking for the equipment, we have an order for the equipment, Medicare has said you can have that equipment, but we don't have a provider for that equipment. So it's a real negative impact